Do you think we're working better as a team with doctors, ministry, health authorities?
I think we've got the greatest opportunity ever to actually take where we were at previously and really enhance it. So I think this a sense of where we're going is going to be a better place than where we came from, because all of us are talking together, we're working together, we're aligning together, we're trying to facilitate each group to achieve the outcomes that we want.
There's a lot of smart people. We have excellent colleagues that are working out in the clinical domain every day, providing exemplary care and service. And I think it's our opportunity and it's also our role to ensure that they get to do that feeling well supported.
And we know that it's all about relationships. We've long talked about the doctor-patient relationship, so that's old hat. But what we don't realize is it's the relationships we've now developed with our other physician colleagues, with our health authority colleagues, and with our Ministry of Health colleagues. When you're sitting at the same table with people talking over problems, co-designing solutions, it's a different world.
I fully agree with you. I think that one of the advantages both Special Services Committee and the Shared Care Committee had was to look at the great work that had been done by the Joint Standing Committee and also by the General Practice Services Committee. So we had a template to follow.
And I think it's the opportunity for me to know that I sit down at these meetings with people that I trust. Because when there's a trusting relationship, I think then we can be candid and honest. We don't always have to agree, but disagreement, I think, sometimes does produce an opportunity for a solution.
The focus by making it so that it's more than just simply seeing a patient, but that we actually are there for the care of the population, that we see the need for the family and the community to be strengthened in all of our relationships. I think that's something that these tables bring very closely together.
What do you see as our biggest challenge as organized physicians in this province moving forward?
I think that a constant sort of difficulty that we've had is to understand how we can most fully engage with our regional health authorities, and how do we bring them into our discussions in a way that makes them feel comfortable that we're heading in a collaborative environment to a new transformed world where they're not excluded but very included, and that we're willing to engage, we're willing to participate, and we're anxious that we can actually transform the system so they get the benefits as much as we as physicians or as our patients would benefit.
And the new voice that we've added to our tables is the voice of the patient themselves.
Yeah.